In this session, let us look at overview of the healthcare systems around the world. You presented 6 countries. Let me summarize all what you have said and look at overview of the healthcare systems around the world. We define a health system. We have some definitions for what is a system, what is a health system. The WHO defines a health system as is a sum of total of all organizations, institutions, and resources whose primary purpose is to improve health. The health system is all the sum of all total of all organizations, institutions, and resources whose primary purpose is to all put together is trying to improve the health of the people. A health system needs various resources, staff, funds, information, supplies, transport, communications, and overall guidance and directions. And it needs to provide services that are responsive and financially fair while treating people decently. A good health system improves people's lives tangibly every day. So that's what a health system is, the World Health Organization looks at. So we are looking at 6 countries as examples. We presented those in each country in detail. The United States of America, Britain, France, Australia, Canada, and Japan. So let's take one by one and summarize what you have said. Firstly, two points to look at is the definition and the categories. How we choose to define this country's health system. What umbrella terms do we use to describe this country's healthcare system? There are various words used to describe. You all use that. Some said you said the system is publicly financed, like that. Description. What does this country's healthcare system entail? And then you discussed about the benefits and the challenges. What are some of the advantages and disadvantages? You discussed that also of each of these countries' forms of healthcare. So, US health system, a lot of people are very critical about this system. What is the category? Where will you put in that boxes? From where does it, what funding comes from? It's basically a privately funded healthcare system. Then you describe it's the only developed country that does not provide universal healthcare. That you mentioned that in your presentation. The USA doesn't provide because quite a large number of some millions don't have access to care because of this private funding issue. Some public funding is provided to, they have within the general privately funded, you mentioned 2 systems. What are those? USA? Medicare and Medicare. Those are insurance systems where the government puts funding. Some public funding is provided to Medicaid and Medicare, but these avenues are not accessible. Even that is not, some people are not covered with that also. There are people without that also, although they don't, it's not a burden. Citizens are required to obtain healthcare coverage from independent insurance companies or pay for healthcare coverage at their own expense. That's the principle. If you are in USA, you have to have a insurance this thing, or you have to pay directly to the provider. 1 in 6 Americans are uninsured. You can see the problem. 1 in 6 Americans are uninsured. Initiation of Obamacare in 2012, which regulates health insurance and not healthcare. Obama tried to regulate the health insurance. Then the benefits. The healthcare that is provided is quite good, quality-wise. the system provides good quality care. Uh, State of the art resources. They have the developed country. They have all the resources. New technology will use. Therefore, they can provide. That's the advantage or the benefits. But they have challenges. What are the challenges? Limited government involvement in conjunction with lack of consensus. So government doesn't, as you said, mostly privately run system in US. Costly for uninsured and low income individuals. So that's why many people can't access healthcare in USA because it's costly. Therefore, they cannot access. Not everyone can obtain healthcare coverage. So it's not. They don't have universal healthcare. Controlling of healthcare spending due to these insurance systems are there. So this is basically the US system in summary. So I hope you got an idea about that. Then the United Kingdom, more close to the Sri Lankan system we presented. Let's look at that. What is that? It is publicly funded universal healthcare coverage. You mentioned that. Like Sri Lankan system, mostly it is. We have privately funded also, about 50%. But similar to that, UK, it's publicly funded. Universal healthcare coverage, they have, everybody can access the care. Description, healthcare is covered by the National Health Service. They have a National Health Service, it is called the NHS. Free at the point of use for anyone who is a resident in the UK. They don't have to pay. Like in Sri Lanka, we can go to access and you don't have to pay to the government. Similarly, UK. Funding of NHS is provided through taxation. Again, like us, taxes are collected by taxes, they pay the bill of the provider. So, what are the benefits? Employs a large number of healthcare workers. They have a huge healthcare workforce. Limited costs for residents. Good standard of healthcare. Again, the quality also much better. Wide range of services offered under the coverage. So, again, they have challenges. Running the healthcare is like us becoming difficult. High healthcare running costs, long waiting lists times, coupled with extensive patient demands. The strain on resources. So these are the problems that they have. Compared to our system, their waiting lists are very high. Then coming to France. What is the France system? Yeah. By both private and provision of universal healthcare with a mix of, it's a mix of private and public hospital and ambulatory care. French system is a mix, both public and private, but they have coverage, universal coverage. Solo based fee for service private practice for ambulatory care. Public hospitals for acute institutional care. Emergencies, they can access the public hospitals. All covered by National Health Insurance, NHI, for reimbursement. They have everybody is covered through a national insurance system. 90% of the population acquires additional insurance to cover costs that are not covered by the NHI. So some people have private insurance in addition to the government national health insurance. What are the benefits? High in health status and overall satisfaction. Again, the quality input there. Ranked number one, as you said, by the WHO, this health system. No gatekeepers regulating people to specialists and hospitals. Referral system. Largest proprietary hospital sector in Europe. Their challenges are decision making is highly centralized. Everything is centralized. Government makes the decisions. Disparities in geographic distribution of resources. Uneven quality in the distribution of health resources. High healthcare expenditure. So these are the challenges for France. Then Australian health system, what is that? Yeah. Yes. It is a mixture of, again, state of, they call the Commonwealth, state funded services in conjunction with private services to provide universally. They also have a combination of both state and this thing. Medicare is the Commonwealth's government's universal health insurance. They have a government insurance scheme called Medicare. Medicare provides treatment at any public funded facility and subsides funding for service outside this scope. Medicare is funded through taxpayers' dollars. So they charge taxes. From that, they provide the services. Citizens encouraged to obtain additional healthcare coverage. Again, like they go for, in addition to the Medicare, they have private insurances also. Benefits: low income earners may qualify for healthcare without paying the required tax, so they have exemptions. Good quality of healthcare. There are limitations to Medicare, and users can still incur costs. Shortage of nurses and doctors now. They are faced with that they are getting people migrating. And then Canada. Yes, what is the system there? Yeah. Publicly funded, like in Sri Lanka. Socialized universal health care. The Canadian system is mainly publicly funded. Federal government provides the framework for the provincial government to administer healthcare via the Canada Health Act. Healthcare control is highly decentralized. Each provincial government run their services. People are covered for healthcare under their own province or the territory. Each province territory determines what is covered under healthcare in addition to the basic coverage outlined by the Canada Health Act. Benefits: healthcare coverage is inclusive of all people, excellent standard of care, funding is allocated according to the healthcare and is separate from health administration funding. So care separately fund, running the services they fund separately. Challenges: tension between federal involvement in healthcare, again the provinces and the center have some conflicts. Healthcare is not uniform for everyone. Private healthcare emergence, shortage of doctors and nurses, growing healthcare costs. Then finally, Japan. What is the Japanese system? Yes, it's a universal public health insurance system. They have healthcare plan encompasses all essential services with the exception of some dental and corrective vision treatment. Eye care and dental, they don't provide even here that sort of some insurance schemes. All enrollees have to pay a co-insurance or a co-payment of 30% on all goods and services with the exception of elderly, young children and low-income individuals. Few people are accepted. Others have to pay 30% of the insurance. All financing is publicly done in conjunction with job-based insurance premiums. Some avenues of privatized healthcare exist but are limited to specialized services such as dental. Payments of primary care services are determined by a complex national fee for service, no gatekeepers. Benefits: achieves good medical outcomes in comparison to other countries like USA. The cost of the health system is lower, large number of hospitals and beds per capita. They have adequate numbers. Challenges: large demand on the healthcare system due to aging population, people seeing the doctor too frequently, strain on public financing, considered not sustainable, patients treated too equally, shortage of specialized healthcare workers. So these are some of the challenges they have. So that is Japan. So hope you got an idea about the different systems, how to classify them, and then you should be able to compare with the Sri Lankan system. Afternoon we'll do some questions from this so that you will be familiar what type of questions that will come for your exam. In the afternoon, we'll discuss with the whole thing and the policy part of it also. Okay, any comments or questions?